Well, thanks for taking some time today to meet with us. We wanted to chat with you about open enrollment coming up and anything that you need to be aware of and what to do with that, as well as some new exciting news too. So thanks for taking some time out this afternoon. I think I recognize almost everybody on here, but my name is Amanda Clark. I'm the Employee Benefits Program Manager at MMIA. I have the rest of the EB crew on here as well. Randy is on here as MMIA staff. We have Chris Beskid, Alex Matenka, and Nikki Willoughby too. So if you haven't already met them in person, this is their faces to go with their names. So now you know who you're talking to when you give them a call. So anyway, let's get going. We have open enrollment coming up, and what does that all mean? First of all, if you've been with MMIA for a while, we always like to bring up that we are a self-funded pool. We're not an insurance company. And I think that that's really important to understand. I think that, that's kind of a strange concept if you haven't gotten used to it, but we are collectively the cities and towns where we're kind of all together, minding the store and in control of our own destiny for the most part, and trying to make the best of it. Nobody's here to get ahead of anybody else, but just make sure we have what we need for moving forward. And I think that based on that information, everything else kind of falls into place after that, as far as like the benefits that we offer, the resources that we provide to save on costs, and really just trying to do the best we can for everybody involved. And it's been really successful so far. And I that's one of the things I really like about this program, is that it really is kind of a win-win when we collectively do well in the pool. Everybody who participates does well. So that's why we're trying to help everybody out along the way. And when I say we're not an insurance company, we still talk about our health insurance, or employees talk about their health insurance. But what does that really mean? Who is that? An employee might go to the doctor and they say, well, who's your insurance with? And, it's a different story. And I think that, even for you guys who we're reaching out to all the time, much less employees, whether they're new or they've been with the city for a while, or their family members, it's kind of hard to wrap your arms around all of these different groups that we have involved. And we're hoping that our participants get used to seeing some of these names and logos as they come across as resources for them to use. But really, who is the health plan? And, it's not even MMIA so much as MMIA represents all of these member cities and towns across the state that are working together to make this program successful and offering benefits to employees. Right now, we have 88 cities and towns that are participating in our programs. So you're in good company. After open enrollment, but looking out ahead, this is kind of a great opportunity to talk about one of our most important programs for managing costs and health within our program, is our wellness program. So the good news is that we're keeping things the same. We want employees to get used to what they're doing and be so familiar with it that they don't even question whether or not they're going to do it. And even more so, they encourage their coworkers and families to participate with them. So we're again offering 4 activities with $50 incentives for each of those. They can go get a health screening. We are working with It Starts With Me to get a schedule put together so you can kind of get that out on the calendar and be prepared, ready for what's coming up. Kind of save the date, if you will, for you and your employees getting in on that. Again, 80% participation if employees participate, employees who are on the medical plan, then everybody who did the screening, including spouses and retirees, get an additional incentive. We've seen some great increases with groups over this last year. Besides what I kind of like to talk about as far as like a critical mass of employees that you get used to doing this and it spreads to other employees that are participating. We've seen some great demonstrations of leadership to get people involved and create a new message around this to increase that participation. So if you have any ideas, or of somebody that's would make a great health champion to kind of help spread the word and make this even more successful, let us know. We'd be happy to work with you to try to make that happen. We also have the education video and quiz to be able to provide some additional information while we have the audience to our participants. Again, things that are going to help them out. This last year, we had some resources that we highlighted, and we definitely saw an increase in use in those resources. So that was a great opportunity. This year, we're going to focus a little bit more on some foundations of health, 3 areas to focus on across the board, whether you're healthy and want to keep maintaining that, or for folks that might have a few chronic conditions that they're trying to work on, some actionable steps and ways to really improve or maintain their health. And then finally, our health screening review call. We have on here that July 1st through September is for our screenings and education video. The health screening review calls actually go out to early November, because if people are doing their screenings right up to the end of September, we need to give them some time to get in on those review calls. And the health coaches we're working with from Take Control that are doing these reviews really do such a great job of explaining things in an understandable way and finding real actionable solutions for people to work on that they can incorporate into their life based on what's going on for the person, not for a checklist that they're going through for something else. So really encourage people to follow up and do those phone calls. It's well worth their while to do so. In particular, last year, we included vitamin D testing in our screenings, and it was really interesting to see. I think a lot of folks really enjoyed getting that additional information. But what we found is that half of the population that did the screenings was good on their vitamin D levels, and half of our population actually needs to work on that a little bit more. And that's not too surprising, being so far north up here in Montana. But even more so, I mean, our screenings were done in the middle of summertime when the sun shines at its brightest and people are out taking advantage of outdoor activities. So we're excited to offer this again to see what people have done to improve. Vitamin D is so important for so many different areas of our health and well-being. And even studies have shown that COVID, or having higher levels of vitamin D, helps to kind of stave off COVID from happening for people, or if they do get COVID, that it helps in their recovery from that even more so. So it's easy to manage. It's easy to take more vitamin D if needed. So we're offering that again so people can see how they performed since last year in getting that information. And then we're really encouraging people to get their review calls scheduled as soon as they do their screening. We want to have them scheduled for about 3 weeks out so people have time to get their results in, and everybody's on the same page for that. But encouraging people to get that done when possible. We can even work to show up at screening locations to encourage people right there at the screening to go ahead and get it scheduled. Or if we're not able to do that, if there's somebody in that area that can help out with that, it really does make a big difference for getting people to get those scheduled before they run out of time at the end of the year. For retirees, we're getting a lot of folks who are retiring at this point in their careers or planning for it sooner than later. And so you being the benefit contact, I might be hearing a lot about this from your coworkers or getting questions about it. So first of all, anybody that is going to retire, they need to submit some sort of form to us. Just by retiring. So if they're going to stay on any of the MMIA benefits, they need to submit a change form. If they make no other changes than changing from employee to retiree status, we need to know that. If they're going to leave the MMIA benefits completely, nothing left over that they want to participate in, they can complete the termination form. But they can pick and choose their benefits separately, whether you allow that for employees or not. If a retiree says, hey, you know what, I'm going to go on something else for my medical, but I want to keep my dental. I have certain things that I want to keep there. They can do those separately as long as they continue to pay for that coverage. We do need to have that done within 31 days of the retirement date. If a person is not Medicare eligible, typically under 65, as a retiree, of course, they can stay on the MMIA plan if they don't choose something else, and they will pay the same rate or the full rate that an active employee pays. Once a retiree becomes Medicare eligible, or if they're Medicare eligible upon retirement, they can stay on the MMIA plan. The MMIA plan will pay secondary after Medicare. So because Medicare's picking up that first share of the costs, it is a reduced rate for them to be on the plan. Or they could choose something else. Medicare, the way that it's set up, there's a Medicare Advantage plans, a variety of supplement options that they can do in coordination with Medicare Part A and B. Or we have at MMIA, we've kind of sponsored an employer, well, I shouldn't say employer, a Medicare Advantage plan through Blue Cross Blue Shield. So it's not an MMIA plan, it doesn't come through us. You don't need to deal with it. We just work with Blue Cross to make it available to any of our retirees. And there's some benefits of doing that versus maybe another Medicare Advantage plan, maybe availability versus other things for that retiree's area. There's some other bells and whistles in terms of dental or vision coverage if they choose that, or other perks. And then the biggest thing is that this Medicare Advantage plan fills in the donut hole for prescription costs, which is a big deal for retirees that have prescription expenses. We encourage people to talk to a local agent about options that they have. We do have one that we work with for the plan that we've worked with Blue Cross Blue Shield to make available. Or there are advisors free to retirees that reach out and ask for help through the State Health Insurance Assistance Program, or SHIP, that can help a retiree trying to navigate what to do. Besides that, we do have a lot of information on our website. We have a recorded presentation that goes over a lot of this information in more depth, and other resources for people to look at on there. For open enrollment, the timeline, we are trying to collect up data and information through the end of January to see how things are looking, so we can give you an early rate indication next week. Next Tuesday, we're shooting to send out information on what it's looking like, a ballpark of what our rate adjustment for July 1st might be, just like we do every year. Of course, our program agreement requires members who've been in the program for longer than 5 years, if they intend to leave the program, they need to let us know by March 1st, so that when we go through our rate setting process, we have everything accounted for and what to expect moving forward. So we need that by March 1st. We have a board meeting in March. We will set final rates at that point when we have a little bit more data, and we will get that out towards the end of March or early April to you guys. And then, of course, with that complete information, if not before, please feel free to submit before, but group election forms where you get to decide, what employees get to choose from for benefits, or what you're going to provide for benefits to employees. We need that choice back by April 14th. That's an online form that you can fill out. And that might be, hey, you know what, we've only been offering the Madison plan, but we're going to open up to the menu of the 4 medical plans. Or, we've never offered vision before, but we want to add on vision this year. Or it might even be your waiting period for benefits. Maybe you've always had 30 days from the date of hire before a person starts getting benefits for any of the coverages. And you want to change it to date of hire. This is your opportunity to make that change, report it to us to go into effect for July 1st. And then, of course, once we've gotten all of that information in, so we know which cities are offering which benefits, then we can set up open enrollment for employees to get to pick and choose or make changes to their benefits from May 15th to June 15th. Of course, we need that all in by June 15th to get it all recorded and taken care of before July 1st. But you can certainly encourage people or require your employees to get that done before June 15th. If you want to say, hey, that all needs to be done by June 8th, so that you have a week to look over any changes and get that all accounted for on your end before finalizing it for us. Like I said, no more paper forms. So the group election forms are available on our website. We also have the individual enrollment or change forms on our website as well, so that employees can go out there. For both, it's great having this online form so that it standardizes things for us, but it walks you through the process of what choices you need to make, and you know, rather than trying to figure out what information goes where, that type of thing, it really helps to kind of guide the entries for that. And in particular for the enrollment forms, we're able to customize that a little bit. So an employee from one city that might be offering certain benefits, medical, dental, vision, knows what choices they need to make there versus another city that maybe doesn't have dental available. That option wouldn't even come up for an employee. So it helps to kind of clear that up for employees and get that done correctly. An important point I want to make about this is that for anything other than the termination of benefits, you will get, as the benefit contact, you will get an email with the information of what has happened so that you can look it over and approve it. It's your opportunity to make sure everything looks correct, but also that we're on the same page about what's happening there for your end of things too. Just a couple reminders, not necessarily about open enrollment, but just in general about enrollment, since we're here talking about it. If you have any elected officials that you allow to participate in benefits, of course, we want to have that resolution on hand if you haven't already sent that in. But if they maybe lost a seat in an election or decided I need to move on, is not working for me, whatever, or an employee who is terminated or becomes ineligible for benefits, we need to have them terminated from the plan. And we need that done within 31 days of their termination or loss of eligibility. Newborns are not automatically enrolled in benefits. So if an employee or a spouse of an employee has a baby and they want that baby to be enrolled, we need to actually have an enrollment form for that. Otherwise, they'll miss out on benefits. Until open enrollment, we need that done within 31 days. Of course, if the parents don't have a social security number right away, don't wait, go ahead and get that in. We can always come back and fill that in later. And then this one's a little bit tricky. Newly hired employees need to have their enrollments done within 31 days of their date of hire. Sometimes we have groups that have a waiting period for benefits longer than 31 days. So they're waiting until that date when benefits become active to fit within that window to turn in benefits, but we need it to be within 31 days of the date of hire. We'll get that all set up and squared away. And then once the benefits are made active, that will all fall into place. And then finally, this one gets a little bit tricky. Of course, a divorced spouse is not eligible to be on the plan. Unfortunately, sometimes employees may not let you know what's going on in their personal lives. But if they have a spouse covered and they do get a divorce, that spouse is no longer eligible. We've had a couple situations where the employee and ex-spouse maybe have some sort of agreement of, well, I'm supposed to cover their benefits for a certain amount of time. Well, you might need to do that financially, but that doesn't mean that they're eligible under the plan to participate. So we do need to have them terminated. Moving on to open enrollment. We will be sending out to employees about the beginning of May, once we have all of your group election choices turned in, and right before they have to make all of their choices for open enrollment, we will be sending out a web key, and the web key will come on a card. If they plug it into a USB port, there's no information contained on there. It just is going to direct their computer to open up our web page. So all of the information will be on our web page. They don't technically need the web key in order to get to our website, but we are required through regulations to send something to everybody. So this is the most effective, efficient way for us to do that, where we're directing them to go there, whether they want to type it in or just plug in the web key. They can go to our website. And if an employee doesn't have internet access or even a computer access to get that information, the information will be on there for them to contact us, and we can send them hard copy versions of everything, including notice requirements, any benefit updates, or information about our wellness program coming up. That will all be out there. What is not going to be included is rates. We have some variable rates and options across our members participating in the pool, but more importantly, we don't know necessarily what your contribution setup is for employees. And so if you can give that information of the rates and your contribution, all of that stuff to employees as part of the open enrollment, that will help employees know what they need to decide for moving forward. So beyond open enrollment, some exciting news of new things for the program starting July 1st. One of the issues that we face is growing costs of prescriptions. So the majority of our costs are still medical, but the cost of prescriptions is rising faster than anything else in our program. So medical trend is 7 to 9% about these days, and I'm talking nationally, regionally, not necessarily particular to our group, but all medical costs in the country, where prescription trends is more like 9 to 10%. And as part of that, specialty medications are actually more like 12 to 14% increases on those. So we're just seeing a lot of growth there. So what do we do about it? If we're seeing these costs go up, how do we get some control over that? ProAct, the pharmacy benefit management group that processes prescription claims for us, has brought us a new program called ProAct Plus. And ProAct Plus has a bunch of opportunities for some of these really expensive prescriptions to find some funding or savings for those costs to the program. And of course, if the program's saving money, that means participants are going to save money out of pocket as well. So there's three pieces of this: the specialty funding assistance, copay optimization, and an international mail order service. So really, we've actually been doing a lot of these things already. And this new ProAct Plus service kind of packages it all together under ProAct instead of separate things, and really just kind of levels up the capabilities of what we're doing for service to participants and cost savings for these prescriptions as well. So the specialty assistance is currently going through a specialty pharmacy Noble, and that will still be coordinated through Noble, but ProAct Plus will take it to another level. We're already doing some copay assistance from manufacturers, but this brings in new funding sources and at a much higher level where the savings will be a larger portion of the total cost. In fact, might even cover all of the costs of the medication, in which case the participant would have no out-of-pocket expense, and the plan saves substantially on those very expensive medications. The copay optimization expands some of the copay assistance that we're doing beyond just specialty medications, but some very expensive brand names where there might be some manufacturer assistance or cost savings out there, where ProAct behind the scenes might go out there and find that, put it in place. It should happen all pretty smoothly and seamlessly to where the participant doesn't even know, but might even show up at the pharmacy and, my copay is lower than I thought it would be, or, I don't have any copay. That's fantastic. The international mail order, we are already offering an international mail order program that a participant can choose to take advantage of. This new, more expanded international mail order will be coordinated through PROACT so that they can kind of help walk through the process of that, or maybe even make it easier for participants to take advantage of that option. And this international mail order has more prescriptions that we have access to in this service, where there's been a limit. We can't do temperature sensitive drugs currently, where we're able to take advantage of some of that, and some very expensive things that can save quite a bit. Of course, all that savings helps keeps rate down. And of course, if we're able to do that, we give it to our participants for no copay. So a lot of the same stuff, just simplified, coordinated, and bigger savings altogether. So that's all wonderful, great news, but there's a requirement that we need to have a certain benefit design for our prescriptions in order to do that. The great news is that it's the design that you guys already have, a flat copay structure right now. It's not changing. The copay structure is $4 for generics, $20 for brands, and then there might be here and there a couple non-preferred brands that are $50 per prescription. So we have in the past been offering a percentage prescription option, where really the benefit of for prescriptions was just part of the medical benefit, where the deductible applied and then co-insurance. So participants were sharing more in the cost of the drug depending on the pricing of the drug. So because participants were taking on a greater share of that, it was a lower expense to the plan, or a lower rate charged for those benefits. So we need to move everybody into this benefit design, so we have consolidated benefits across the board for everybody. But if they've been getting that for a lower price, does that mean we need to increase their rates? Well, no, we can't do that to them. That's a 16% rate adjustment. So if we are going to give them the benefit of this higher benefit, this lower cost to participants of the plan for the same price that they've been having at 16% lower, how does that work for you guys? If you have these benefits already, same benefits are going to stay in place. We're going to lower your rates to match the groups that have been offering the percentage benefit. So that's a great piece of news in terms of the cost. So all things being equal, just because of this PROACT Plus program, your rates will be going down for the Bridger Madison admission plan by 16%. Benefits all stay the same, rates go down. The high deductible plan will stay the same. The high deductible plan, in order to be HSA eligible according to the IRS, needs to have everything applied to the deductible, a higher deductible. And then benefit percentage after that. So that needs to remain the same, because the benefits are changing there, and they've always been the same for both percentage and copay prescription options. The benefits stay the same and the rates will stay the same for those, but for Bridger Madison admission, the rates will be going down. Now, this rate adjustment is entirely separate of any base rate adjustment that we do. So just for this program, standalone, by implementing PROACT Plus, consolidating our benefits, the PROACT Plus program will be bringing more savings than the cost of making this rate adjustment for your group. So not everybody's getting a rate adjustment. These groups on this webinar will be getting a rate reduction to match other groups. And that is kind of standalone. So we may still have a base rate adjustment that's due to medical cost increases, other things going on. Any rate adjustment that we do or that we set when the board makes a decision on final rates in March will be because of any of those other things going on, not this PROACT Plus or rate adjustment. So let's just say that we come out with a 3% rate adjustment increase. So what that would mean is that for the Bridger Madison admission plans, it will end up netting out to be a 13% rate reduction, and the high deductible plan rates will increase by 3%. So I hope that makes sense. But otherwise, benefits the same, an improved rate. We'll have to see where we end up. Don't hold me to the 3%. But we're waiting for some more information to get that out. So I kind of just went through all of this, that the costs for the benefit consolidation and Product Plus, just to reiterate, result in a rate decrease for the three of the plans that you're offering, and that will be separate and combined with any base rate adjustment that we need to do for renewal, and we will communicate what that ends up being, like I said, at the end of March or early April. So at this point, without knowing where we end up for overall rate adjustment, we will share that information with you. You can certainly share with your mayor, council employees that overall you will be getting, there's no way at this point that our rate adjustment will be 16%. I can say that much at this point. So overall, you will be getting a rate reduction in that area, and benefits are staying the same otherwise. In terms of communication with employees, for the most part, any of this ProAct Plus services, like I said, we will be working with them up until July 1st, where most of that is going to be behind the scenes coordination to implement and transition for some of those opportunities. If there does happen to be any information that needs to be coordinated with a participant, we will be working with ProAct. There will, we will outreach and kind of work one-on-one to facilitate that as easily as possible. Otherwise, that will be all on our end. And if you have any questions about that, you can certainly send anybody our way, and we can make sure that everything's in line for them. So I guess with that, I don't know if there's any questions. I really appreciate all of you taking time to be on here to walk through some of that. That's a lot of information to kind of pile together in a couple different subjects for you, but we can follow up after this with some more information on ProAct Plus and the rate reduction, why that's happening or how that's working. We can send that out to you. And we've also recorded this presentation. If you want to look back on it, you can let us know or share it with somebody else. You're more than welcome to reach out to us and watch it again, because I know that I am such a riveting presenter. You can't pass this up once. So anyway, I don't know if there's any questions at this point that I can help to answer or go over. And then, of course, you can reach out to us afterwards if you do have more questions. Overall, this is good news. We have a great program. We are moving forward with similar stuff, great resources, good benefits, and a rate reduction, which is exciting news. That doesn't happen often in benefits. We have a question about MMIA scripts and timing. We'll reach out to you and find out more about specifics. This new program will actually be through a different group than the MMIA scripts vendor. And so we expect there'll be some changes, but actually things should go a lot smoother, quicker, easier with it because of proximity. It's a pharmacy in Canada, a brick and mortar pharmacy in Canada, and because of ProAct coordination, where they can get a little bit more involved with not just the prescription, but also with providers and submitting the script, some of that stuff. So we expect the service to actually improve on any international prescriptions that people are able to take advantage of. Well, thanks again for taking time to meet up and walk through all this with us. Gives us plenty of time to work ahead of things and be ready for open enrollment, especially if you have any questions or anything comes up from employees or anybody else that you talk to, and let us know what we can do to help.